We are able to incorporate, and we have incorporated, simulation to improve the care that's being delivered in long-term care facilities in Western Pennsylvania and beyond. We took simulation on the road to over 20 long-term care facilities in the western part of Pennsylvania. With those simulations, we worked with nursing assistants, nurses, nurse practitioners to improve educational methods and education handoffs, reports between those healthcare providers. Things like that are unheard of with simulation, especially when it comes to using simulation with our elderly or aging population. We created training videos that focus on ways of improving communication with long-term care providers.
It's interesting that when you're teaching, you actually sometimes have to look at a student and say, the lecture last week, in your notes, this is now. This is when this is happening. And you can see the light bulb almost literally come on in their eyes. And they go, oh. They can take a book test, they can take a paper and pencil test, but until they actually see the knowledge applied in a clinical setting, they don't necessarily make the connection.
We definitely have an expert faculty team. No other place, I think, will you find the dedication, the clinical expertise, the level of scholarship, and the engagement that our faculty have with our students. I think that's paramount to our success, our faculty.
Because we have dedicated simulation faculty, which is fairly novel in the United States today, they get to see everybody in a class. They know where the middle of the bell curve is. They know where 2 standard deviations above and below the mean for student actions and simulations really are. And they're able to explain this very clearly to clinical faculty. And so being able to marry those two things together, to be able to spend more time as a clinical faculty member with those people who really do need more time from me as a clinical instructor, identified by the simulation faculty, is a real gift. I think that is one of the most novel and innovative things that we're doing here at Robert Morris.
We have connections with many of the large healthcare organizations, the CEOs, the CNOs, the experts in healthcare delivery that we reach out to that contribute to what we do here at the School of Nursing and Health Sciences. They serve on our advisory boards, they serve on our board of visitors, they come, we ask them questions, they contribute to the work that we're doing here.